Bismillahirrahmanirrahim. Good morning, my beloved student. Today, I will present an important topics. I am Dr. ATM Mostafizur Rahman, Assistant Professor, Department of Surgery, Bashundhara Ad-din Medical College Hospital. The topics is more important in undergraduate and postgraduate students, and it is more common in our day-to-day practice. Today, I discuss an important issue like diabetic food. You know, diabetes is the more common disease in our country and abroad. Diabetes, you know, it is a common problem in our country. About 12 to 15% of the patients or human being suffering from diabetes. You know, in case of diabetes, our blood sugar is uncontrolled. It increases and it produces both microvascular and macrovascular complications. You know, there are different types of diabetes: type 1 diabetes, type 2 diabetes, and other types of diabetes. In diabetic food, problems are the common in type 1 and type 2 diabetes, in which 20 to 40% of diabetes have the feature of peripheral neuropathy, may or may not be associated with features of peripheral vascular disease. 15% of the diabetes developed food ulcerations. So, diabetes is recognized as a leading cause of non-traumatic lower limb amputations. You know what is amputations? Amputations is defined as transections of limbs through a bone. When it is separated from the joints, we called disarticulations. You know, sometimes the amputations may be therapeutic, sometimes amputations may spontaneously, it is called auto amputations. What is the pathophysiology of diabetic foot ulcer? In case of diabetes, our cholesterol level is uncontrolled, so patient developed atherosclerotic change. In atherosclerosis, different types of cholesterols are uncontrolled. Basically, HDL, LDL, triglycerides, and other types of cholesterol is abnormal. In diabetic foot ulcer, other pathologies includes peripheral neuropathy. It is the common complications of diabetic foot. Infection and impaired metabolism in the tissue levels, and sometimes forms arteriovenous fistulations or arteriovenous fistula formations. In atherosclerosis, accelerated in diabetes, which produces internal damage of blood vessels, typically trifunctions and distal small vessels disease. Large vessels disease also occur earlier and is more severe in diabetes. Sometimes blood vessels calcifications may produce distal blood vessels poor flow of blood. So, it is the one of the most complications in diabetic patients. Gradually patients develops thinning of the skin, loss of hair and shininess of the skins, and poor perfusions of the skin causes ulcerations. In diabetic foot, second most common complications is peripheral neuropathy. In motor nerves, distraction of the small muscles produces clawing of the toes and subluxation of the joints and causes abnormal weight bearing and traumas. In sensory nerves, especially gloves and stroking paresthesia. When I put a gloves in the hand, the cushions covering the gloves, and when I put a strokes in the foot, the portions cover the foot. These portions are develops in paresthesia. What do you mean by paresthesia? It is reduced pain sensations in these portions. Autonomic nerves are included in peripheral neuropathy, distraction of the vessel control and sweating. In diabetic disease, sometimes it produces involves the autonomic nerves and causes the involvement of the skins and reduces the sweating in case of peripheral neuropathies. Impaired tissue metabolisms. It is the third most common complications, or it is the pathophysiology of diabetic patients. Due to hyperglycemia, glycolysis of tissue renders stiff and loss of pliable. The third most common complications is infection. It causes due to increased glucose in blood, which invites the bacteria. The bacteria is more produces in a high blood glucose level and causes the infections of the different systems of the body, more common in urinary tracts and produces the urinary infections. The fifth most common complications or pathophysiology includes arteriovenous fistulations. It is an abnormal communications between artery and vein and causes bypass flow of blood from one portions of the blood vessels to another portions. So, causes the hypoxia of the distal portions of the blood vessels. What is the clinical features of diabetic foot? The clinical features include ischemic ulcer, which involves the heels malleolus, head of the fifth metatarsal, toes, tip of the toes, between the toes and ball of the foot are the typical site for ischemic ulcer. Ischemic ulcers usually occurs in multiple small joints and parts of the foots, which causes look like a poor healed wound or punched out lesions, and surrounding callus is formations. Another clinical features includes neuropathic ulcer, commonly seen on the sole of the foots, and punched out lesions surrounded by a ridge of head calloused skin. Charcot's joints included in diabetic foot patients, where painless disorganized joint due to decreased sensations, loss of foot arches. You know there are different types of foot arches. In diabetic foot patients, there is subluxation of the joints, so the arch of the foot is malformed. So, in case of diabetic foot patients, there is development of peripheral neuropathy. So, the tone of the small joints and small muscles, so the loss of arches of the foots. Now, another important clinical features is shiny hairless leg. Sometimes auto amputations of the toes. Some of the patients present our chamber with these types of complications or these types of problems. Sir, I do not know, but I do not found a part of the toes. Here we see the problems, and necropyosis is the one of the complications of diabetic foot patients, and sometimes it is a clinical features, and sometimes patients present with infections. It is one of the common complications in uncontrolled diabetic foot patients. How we manage a diabetic foot patients? Management depends upon the 3D of diabetic patients management plan. In diabetic foot patients, it depends on diet, drugs, and discipline. When our diet is abnormal, we cannot control the diabetic patients within diabetic blood control levels. So, it is one of the important issues. Our management goals includes prevention of complications is preferable to be needed for active management. Patients should be monitored and self-care encouragements. They should be educated about washing, care of core and calluses, and toe-nail cuttings, and suitable foot wearing. Management of infections is included. The wound wash often shows the both gram positive and gram negative and aerobes bacteria. In diabetic foot patients, the infection occurs both gram positive and gram negative organisms and aerobes of the organisms. Osteomyelitis is one of the common complications or infections of the bones is the one of the complications of diabetic foot patients. You know what is the osteomyelitis? It is an infection or inflammations of the bones. It may be acute osteomyelitis, it may be chronic osteomyelitis. Sometimes we involve the orthopedic surgeons in diabetic foot patient managements, and we need an X-ray in different views to know the osteomyelitis or sequestrum formations in the bones. In infection patients, we routinely do the procedures or ensure the daily dressings with povidone iodine, hydrogen peroxide or usual solutions, and start a broad spectrum antibiotics like ceftriaxone, gentamicin and any other antibiotics. Sometimes we need surgery like amputations or disarticulations of the joints, or sometimes may needs skin graft or skin flaps or rotation flaps or any other else. Sometimes patient loses part of a limbs and included a prosthetic limbs for daily movements of the bodies. Management of vascular insufficiency is one of the important issue in diabetic foot patients. Sometimes it causes atherosclerosis of the limbs and produces some pathophysiological changes in the distal part of a limbs. How we manage the vascular insufficiency? Sometimes we included anticoagulants like ecosprin, clopidogrel or any other medications, and sometimes we need surgical interventions like embolectomy or bypass surgery or any other prosthetic tissue grafting of the fascias. It is the important issue of diabetic foot management. Then the most important issue is control of blood sugar. It is more important if we not control our blood sugar within normal range, our complications gradually increases and our limbs gradually shortened. So we need important anti-diabetic drugs like oral hypoglycemic agents or insulin. Sometimes patient may take anti-diabetic drugs, but diabetes is not controlled within normal limits. So, we prescribe insulin, either short acting, intermediate acting or long acting. So, we concluded my topics diabetic food. So, in conclusions we tell diabetic food is one of the more devastating conditions of our patients and our countries and in the world. So, we take our diabetes control and we maintain the discipline and we manage our diabetes by our physicians and surgeons. So, my students, I thanks to join my lecture. If any other queries, please contact with me in different issues. So, I conclude today my presentations. Thank you our students.